So now we can start talking about all the drugs that we can use to treat acid-peptic diseases. And I'm going to start with the oldest one. These are the antacids. So antacids are just weak bases and they neutralize acid. So that's their mechanism of action. They neutralize acid. So that means you're just neutralizing all this acid here with weak bases such as calcium carbonate, aluminum hydroxide, magnesium hydroxide. So weak bases neutralizing acid. They are best if you use them after a meal, so 30 minutes after a meal. So that's called post-prandial dosing. They give you pretty quick symptomatic relief. One big disadvantage is they chelate drugs, so they love to bind to stuff. And so if your patient is on other drugs, you need to separate these drugs out because they're just going to bind to it. Aluminum generally leads to constipation by itself, and magnesium leads to diarrhea in terms of adverse effect. So those medications are usually packaged together as these effects cancel each other out. Otherwise, they're fairly safe drugs. They're not going to heal an ulcer because they will not change the pH significant enough to heal an ulcer. So they're really only for symptomatic relief on an occasional basis. The only other adverse effect I want to mention, every antacid that has a carbonate in it, I mean, that's going to lead to CO2, so that's going to give you some bloating, some belching. That's another adverse effect. Okay, that's it for the antacids. Let's move on to the next drug class. We have drugs that block the histamine receptors. They're called H2RAs. Histamine 2 receptor antagonists. I'm going to just write here also H2RAs. And these are drugs ending in tidine, cimetidine, ranitidine, famotidine. So these are the tidines. And what are they doing? They compete with histamine for the histamine 2 receptor, which is on the parietal cell. So if you block this, you're going to have less acid production. And they are much more effective than the simple antacids because they block one important way in stimulation of acids. It looks like that histamine is mainly responsible for the nocturnal acid production, so overnight they are particularly effective. They are very safe drugs with not too many adverse effects. Cimetidine has some specific anti-androgen effects, so it can lead to galactorrhea, menstrual irregularities, and impotence. So that's only for cimetidine. The others have very mild adverse effect profile, a little bit of headache, nausea, but very close to placebo. Cimetidine has also CYP interactions. But again, this is all for cimetidine, so that's a kind of a special one. All the other ones have a side effect profile very similar to placebo. Next, we're going to move on to the most famous class of drugs, which are the PPIs, and that stands for proton pump inhibitor. And those drugs all end on prazole. And a famous one is omeprazole. And what are they doing? Well, they inhibit the proton pump, this H plus K plus ATPase. So they are just right here at this final step of kicking out the acid, that's where the PPIs act. So the proton pump inhibitors. They actually inhibit the proton pump irreversibly. So let's add this: irreversibly inhibit that. And you may know that these proton pumps are actually not all the time right there at the lumen. They are found in vesicles here inside and then kind of go out to the lumen, and then some of them travel out and then travel back again. So if you give your first dose, you're not going to hit all of them at once, because not all of them are even here at the lumen. So you usually need a couple of doses so that you see the effect kicking in. So that's an important thing about the PPIs. You cannot just take them on occasion if you eat a lasagna and have some heartburn. That's where you need to go to the antacids. But the PPIs are really for this long-term treatment when you want to change the pH and when you want to heal, let's say, ulcerations. So again, not to be taken just occasionally. What are adverse effects of the prazoles? So generally, the adverse effect profile is also very similar to placebo. There are some nutritional concerns, because usually people take these drugs for a pretty long time, and there are several electrolytes, vitamins that are dependent on stomach acid. So there is some data, but it's not very good, on vitamin B12, calcium, magnesium, that you may end up with lower levels due to this long-term treatment of the prazoles. There's also a concern about risk of infections, because you're taking away this important sterilisator, stomach acid, and there is an increased risk of respiratory and enteric infections. And then also omeprazole is a CYP inhibitor, so you're going to have some CYP interactions, mainly with omeprazole. Next, I want to introduce you to a fairly new drug class. These are the PCABs, and this stands for potassium competitive acid blockers. So they compete with potassium. You see here the potassium getting back in exchange for the protons, and these PCABs, they compete with potassium at the proton pump and inhibit the proton pump. They all end in prasen. An important example is vonapresen. And they were fairly recently introduced, and they are an alternative to the PPIs, because they also inhibit this final step. You may wonder, so what are the advantages of this new class of drugs over the good old PPIs? Well, there are some that it looks like they're even more potent. Also, they block the resting and the active proton pump. So I told you before that there's always kind of some vesicles traveling these proton pumps out to the luminal surface and back in again. And so with this potassium competitive acid blockers, you just block all the proton pumps, so you don't need necessarily a couple of doses before you see an effect. So they're definitively gonna have a quicker onset of action. So they are generally more potent at sustained acid production. So far, no very specific adverse effects have been reported, so it looks like they are pretty similar to placebo as it relates to the adverse effects. The last drug I want to discuss under this category of suppressors of acid production is a drug misoprostol. And if you look at the name, it has prost in its name, so it's a prostaglandin derivative. So it stimulates here this prostaglandin receptor, misoprostol, and that leads to an inhibition of the acid. And remember, before we had also a surface mucus cell there, and prostaglandins also stimulate mucin production, so it's actually increasing mucin production and decreases acid production. So it has this dual effect. So it's actually a pretty good idea to use this drug. However, there's a couple of big disadvantages. First of all, you have to take it 4 times a day, so it's not very convenient. And then there's also 2 very important adverse effects / contraindications. I mean, always when we're dealing with prostaglandins, prostaglandin can stimulate your GI smooth muscle. So as an adverse effect, you can get diarrhea. And then very importantly, it can also stimulate uterine smooth muscle contractions. So it's absolutely contraindicated in pregnancy. That's about it what I want to say about misoprostol.